Yeah, welcome everybody to the September Grassroots Conference call. I can't believe we're saying that. So I hope you're all refreshed, able to have a nice summer break and are ready for the autumn. Don't think this is anyone's first time on the call, so I'll skip that bit of my script. So I think, as always, we're going to hear from our expert speaker later on. And this month's action is on polio. And obviously that's been thankfully largely eradicated from many parts of the planet. But as we'll hear later, there's a really serious risk of its return right now. Just letting people in as we go. So excuse me if I'm trying to do two things at once. Okay, so I'll start off with the usual housekeeping messages. Please keep yourselves muted during the call. If you've got any questions or comments, please use the chat box if you can. You should be able to see the captions, and if you want to disable these or enable them, you can do it on the Zoom chat toolbar. And as always, we're recording the call so that we can put it on our website. But if you want to put your video off, you're more than welcome. And does anyone want to say hello? Not compulsory.
Optional.
Oh, we've got some more people arrived. Okay, so I'm just gonna just make sure that right. Okay, so having got that out of the way, I'm going to start with my usual remarks on the kind of political context for results advocacy over the last month or so. So first of all, as you'll probably know, Parliament's been in recess for just over a month, and I know that many of you have been making contact with your new or re-elected MP, but often getting automatic responses or struggling to get a response and being told that they're very busy setting up their new offices. Thank you for persevering, basically. We believe the letters will be seen eventually, even though you may not get a response. And the reason I say that is because this month we're asking once again for you to contact your MP, and we'll explain why we think this is the right thing to do at this point in time a little bit later on the call. Parliament's now back at work for a couple of weeks, starting from this week, and then it'll once more go into recess for the annual party conference season from the 12th of September. So they're literally only back for a few days. Thank you to those of you who have got in touch offering to help at party conferences, where we will be trying to present the work we do and make contact with MPs and explain the importance of the work and what they can do to get involved. Thank you also to those of you who were able to invite your MP to what we're calling a development fair in Parliament next Tuesday, the 9th of September. This is a drop-in session we've organised for MPs to learn about the development issues that we're working on, and we'll also be there with other agencies. It's not just results. We'll be working with other agencies from the umbrella group Bond. And we hope MPs will sign up and get involved, for example, by joining relevant all-party parliamentary groups, APPGs, which take leadership on a range of issues, not just development issues. So as probably a lot of you know, but maybe you don't all, at Results, we provide secretariat support for 4 of the APPGs. That's on global vaccinations, education, nutrition, and I've missed one, TB. We support the MPs who want to get involved on those issues. Next, I would like to just share some news following last month's action on asking the government to prioritise drug-resistant TB at the forthcoming UN high-level meeting on antimicrobial resistance, or AMR. That's quite a mouthful. So we are hearing that the Development Minister, Annalise Dodds, may well attend the UK at the UN General Assembly alongside other ministers. So there is everything to play for. That's what we're asking her to do. It's absolutely essential that she attends this session and shows UK leadership on AMR. So if you haven't yet written your letter, it's still very much worth it. And we're going to put Oh, there it goes. The link to the action materials in the chat box. And that's the same as the link that you'll have had when we sent those emails around last month. Results is head of advocacy, policy advocacy, Alex Runswick, who is or was on this call a minute ago, will be attending the high-level meeting in New York on Results' behalf, and I'm certainly going to be asking her to sort of, in some shape or form, feedback to you guys so that we can get a flavour of the event from her and what it achieves, possibly on next month's call, but we'll see how that goes. So good luck to her on that. Now, last month, again, we're going to put a link in the chat again. There was a really powerful article in The Guardian on just how how deadly AMR is as a health problem in countries like Ethiopia and Nigeria. And so we'd like just to share that with you in case you're interested in a bit of an in-depth read on how antimicrobial resistance is actually affecting people in different parts of the world. It's, yeah, quite sober reading. So just reflecting on last month again, at the time of our last grassroots conference call, so back in early August, we all couldn't help but notice the rioting on UK streets by people with racist and anti-immigrant views. Now, obviously, that was something that was in all of our minds. And whilst we don't work on domestic issues at Results, it's really, really important that as part of our work, we do stand in solidarity with people from around the world, often who escape, want to live peaceful lives in the UK, often escaping from violence and oppression in other places. And Chief Executive Kitty Airy signed a joint NGO statement on Results' behalf, condemning the riots and the racism that they represent. And we felt it's really important that we put our name to this. And again, we'll link that statement in the chat in case anyone wants to have a read of it. It's, yeah, quite a lot of agencies signed up to this, and I think it's really important. I just want to say one more thing about the context, really. This is a bit of a sort of a mishmash of issues, but we also saw on the news recently, again over the last month or so, the outbreaks of Mpox, formerly called monkeypox, right across the world. And this has been on Results' radar because obviously we work on access to vaccinations against preventable diseases, and this is one of those. Now, whilst it isn't a threat at the same level as COVID, for example, the World Health Organization has officially designated it as a public health emergency of international concern, and they said that back in August. As with COVID and other infectious diseases, it is really important that the global response is fair and equitable, with resources that are available to all countries and not stockpiled by wealthy countries, as we saw with the COVID vaccines, and also that countries are able to develop and produce their own vaccines and treatments and not have to rely on over-expensive vaccines from big pharmaceutical companies. So there's a lot to work on with the global response to this outbreak. Gavi, the Vaccine Alliance, which, as you know, Results advocates on behalf of, has been monitoring Mpox since 2022. And in June this year, they initiated a number of response measures, which include establishing a global stockpile of vaccines, supporting the significant outbreak response in the Democratic Republic of Congo and neighboring countries, and also supporting research to inform future vaccination strategies. And Gavi has formally declared the Mpox situation in and around DRC a regional emergency. And again, if you want to know a little bit more about Mpox, because it's a bit of a new one to some people, we've got an overview from the World Health Organization. It's quite a useful webpage, which we've just put in the chat on that one as well. That's it for the sort of, if you like, development news part. And I want to move on now to the usual kind of roundup of what you've been doing in your advocacy around the UK. So a massive thank you to all of you who've continued to build relationships with new MPs and to struggle with that. or if you've raised issues with them for the first time, and as well as those of you who've been able to invite them to the development fair on the 9th of September. So thank you for all of that. We asked you to write directly to the Minister on antimicrobial resistance last month, but some of you felt it appropriate to copy your MP into that letter as well, which is a really good idea to get them to see what's going on. So thank you to those of you who shared that idea. Thank you particularly to Tony, Kush and Jill, who've shared their actions on AMR with me recently. And I'm sure there are others. Would anyone on this call like to share anything about their recent letters to MPs or to the government or responses that they've got?
Yeah.
Go ahead, Pete.
Yeah. So no response.
No response.
Sorry.
That's fine. And thank you for doing the letter. As I said earlier, we think it's important to carry on doing that, and hopefully they'll respond at some point. Anyone else?
Same here, not a dicky bird.
Same
Haven't
here.
had anything back at all. But he hasn't got an office set up, I don't think, yet. I mean,
they've literally been back in their building since like yesterday. Monday was the first day of the new parliament, the new session rather.
Corin's MP was advertising for a researcher, I saw. So.
Yes, we've seen quite a few of those as well. Kush, you've got your hand raised. Sorry, I didn't see that there.
Oh yeah, no, that's all right. I was just going to say that I've not heard back from my MP on the email that I've sent recently, but I did get a response back from the FCDO correspondence one where I wrote to Annalise Dodds asking her to go to the HLM. It was a little bit of a generic response, but they did sound like they were quite committed to prioritizing AMR. And I've just put in the Zoom chat as well a screenshot of the bacterial resistance report that I'd seen earlier today from a patient. It's anonymized, so don't worry, I'm not sharing anything private. But yeah, it just shows an entire long list of different antibiotics, and next to it, it says resistant, which is really what you don't want to see and is terrifying as a doctor when it comes to trying to pick adequate treatment, and is really why this issue is so important.
Wow, thanks, Kush. That is really, that's quite an eye opener. That little PDF.
That's something that we used to see maybe like once in every few months from someone who'd had like maybe extensive travel to like South Asia, whereas now it's something that we're seeing once or twice a week in patients in the UK. So yeah, it's just, you can see the trend is that it's just going up and up and up.
Wow, thank you. That's a really good illustration. And yeah, thank you again for sharing your letter. I think, yes, we've seen quite a brief response, but a useful one. We do think they're taking it seriously, and we wouldn't have expected them to give us some sort of money figures for attacking that problem at this stage, but we're hopeful that they'll be doing some really great announcements at the event. Anyone else got any sort of feelings to share about their recent letters or responses?
It's not a recent letter, but I just wanted to very quickly reply to what Kush said about the AMR letter, and just to say that I had a meeting with senior civil servants from both the FCDO, which is obviously the department we work with most closely, and the Department for Health and Social Care, who are responsible for responding to AMR within the UK and obviously within the NHS, as Kush was just saying. And they were saying that they're still negotiating on exactly who is going to be attending the HLM from the UK government, and it's all still very much in play. So it's absolutely, still worth getting those letters in, and it's still something that they're working on, that they're pushing on.
Thanks, Alex. That's really helpful. And I hope you didn't mind me sort of name checking you earlier on and saying that you'll be helping us to feedback after the AMR high level meeting to let people know how we've been able to affect that process. Richard.
Well, like others, I wrote to Annalise Dodds. She didn't reply. Dan Tomlinson when he first started, and then I've written to him again recently, inviting him to the development day. But I see Vinny's got his email on that, so he can reply to him. But I haven't had a reply, but I wouldn't necessarily have expected one, really.
Thank you. That's brilliant. Thank you. Yeah, we'll hopefully be able to follow up with him. So if Vinny knows about that, then that's something that he can follow up. So thank you. Let's move on. I would like to thank Marcelo, who I don't think is on this call at the moment, who has been chairing the online group for the last year or so and is stepping back from this responsibility to undertake some personal projects. But he is staying active within the group, and I'm sure everyone within the online group will join me in thanking Marcelo for his amazing work supporting group members over recent months. So a big thank you to him. And then lastly, before we dive into this week's discussion topic, I want to wish our new grassroots trustee, Richard, all the best of luck at the next quarterly results board meeting, which is happening at the end of the week. Along with the existing grassroots trustee, Kush, he'll be able to bring the grassroots perspective to the top of results' decision making. And I'm sure, again, he'll be able to feed back to you after that meeting. And in case you want to get in touch with either Kush or Richard with any issues that you want them to be aware of, then again, we're going to put that in the chat just so you've got their emails. They've got results emails so that they can.
I'm going to put my private email because I don't know how to get that access to that. And just a slight.
Okay, that's fine, Richard. Go ahead.
Very quickly, my trustee journey so far. I've been in touch with all. Some of the trustees have all said welcome, and then we've got a trustee meeting on Friday, which is a Zoom meeting, Teams meeting. Then on Saturday we have an away day. And although it's an away day, it's actually in the office, so it's not really that far away. But it's an all-day meeting, so hopefully next meeting I'll be able to tell you what happened. And if you want to contact me about it,
in person though.
Sorry,
I think the meeting on Friday is in person.
is it?
Yes.
One of the meetings is not in our office, but somewhere else in London. So you're going to need
So
to work out how to get there. I think the details have only just come round. But yeah, good luck. Good luck with
make sure
getting
I turn
there
up.
and with contributing to your first meeting. Thank you so much for stepping forward into that role. So look, I'm going to jump into the main topic of tonight's meeting, which, as I said, is the very concerning potential re-emergence of polio in a number of places around the world, such as Gaza, which has obviously been in the news a lot very recently. I mentioned that on last month's call, and also Sudan is another country, just to name but two. And these are amongst a number of situations that make it all the more urgent to persuade donor governments such as the UK to recommit to funding the Global Polio Eradication Initiative, or GPEI. So that's an international partnership that many of you are aware of that does exactly what its name implies. And it's in need of additional funding for the next 2 years, which is something that has been known about for quite a while. Before I introduce our speaker, I've got some quite sad news, I'm afraid. Many of you will have taken action to support the work of GPEI back in April, and you might have been on the call when its global director, Aidan O'Leary, joined the call as our very special guest speaker. So you can imagine how sad we were to hear the news that he unfortunately passed away unexpectedly last month, whilst on holiday with his family. So that was pretty shocking news. I know you'll agree with me, if you were on that call, that he really very vividly brought to life the challenges and the resourcefulness of the GPEI in getting vaccinations to children in the most hostile of environments. And I know from reading about his life since that his lifelong humanitarian expertise will be sorely missed. And we've got an obituary, there's a number of them, but we've just pulled one out from the Irish Times, which gives a bit of a sense of what he contributed over his career. So I'm sorry to have to share that very sad news. I don't know if anyone had any observations at this. I want to just have a little pause there if anyone wants to say anything. Eva.
Thanks, Naveed. I hope I'm not jumping the gun. I just wanted to reflect that I'm so glad I attended that grassroots call, with Aidan O'Leary. Obviously not realizing that I might never be able to meet him. And yeah, hope his family are coping well. And the polio world is shocked and rocked, especially when there's so much work to do. And, of course, there is a lot of work to be done. But I was really glad that Camilla had arranged for him to come and speak to us and to have that contact time and just be in the presence of some of that magnanimous, very knowledgeable, very passionate persona, and to hear about polio situated particularly in the conflict sphere and the difficulties and challenges there. It was really a brilliant talk, and I'm sure it's recorded somewhere, so we could probably go back and listen to it. But yeah, it was I made furious notes, and he just really lit up my imagination when it came to polio. Thanks.
Thank you, Eva. That's really powerful. And yes, it is recorded and it's on our website as most of our conference calls are. There's someone else with their hand up. Nope, I can't see it. They put them down. Okay, well, look, I'm going to move on from that. And sorry to be that bringer of bad news, but I'm sure Aidan would want to know that his vital work continues. So this month, obviously, we're returning to polio advocacy. And as she's kind of introduced herself already, but it is my pleasure to formally introduce Dr. Eva Khair, who is a medical doctor of 12 years standing, who has turned her expertise to advocacy on child health issues and is now Results' Senior Policy Advocacy Officer on child health. So Eva, welcome to you.
Thank you.
So it's great to have you on the call. I know you've attended one or two of these calls before, but it's really great to be able to formally welcome you this time. So I'm looking forward to hearing your take on the need for advocacy on polio at the moment and how that's changed since we last looked at that issue back in April. And as you know, from previously being on this meeting, you're on the call with volunteers from right around the UK. Some of us have been involved with campaigning on global health issues for many, many years, others who are quite new. But we've all, I think everybody on this call has got quite a good track record of gaining political support and to some degree, financial resources for fighting polio. And I just want us to reflect that we got some significant resources back in 2019, where we got a commitment from the UK government of £400 million. Obviously, as we know, since then there were serious aid cuts in 2020, and a lot of that money wasn't actually provided, but quite a bit of it was. And I think we'll hear a bit about that as we go through. So, Eva, in a minute, I'm going to be asking people to ask you the usual pre-arranged questions to get the discussion started. But before that, we'd love to hear a bit about you, as we usually do. So your background, and then more recently, what drew you to move from medicine to advocacy on international development? So, yeah, over to you.
Thank you. Thanks, Naveed. I'm glad you had to say my title and not me, because I still stumble when I have to get all those words out. But yes, so essentially policy and advocacy, that's the name of the game. And thank you for that kind introduction. Naveed, I'm a physician by background and global health specialist. And essentially, for me, being in the sort of medical and academic world, working on research, was sort of interesting, and it was dynamic for a time. But I think with, after a decade or so in, it became quite clear to me that publishing research was not where, letting it end there was not going to be enough. I wanted to get the research to the door, to the decision maker, to the policy maker, to the mover and shaker. And in many instances, this is a political person, a political entity making decisions about health, whether in the UK or abroad, health spending, health provisions, health services, health systems. And so, it was a very natural thing for me to think, policy, that's the best place to turn my attention. And so obviously now I work with Alex, who's our head of policy, and Naveed and Jess in our amazing comms and grassroots team, and my new colleague Tanya, who's very kindly on her second day hopped on this call at 8 o'clock in the evening. Promise, it's not always this late results, but thank you for making the time. It's a pleasure to have you with us. So, the focus today really is to look at why now is a key moment for advocacy. We have a new government, we have a spending review, and a budget at the end of October, which the country is waiting for with bated breath. And we had an ask that we submitted. So, I'm also working on a briefing to Minister Dodds, and I'm hoping, that by being here, we can sort of marry the two actions, my briefing, in the 9 to 5 and the grassroots power out of hours, delivering all of those messages in. So I'll leave it there for now.
Thanks, Eva. And yes, welcome, Tanya. Sorry, I should have introduced you earlier. Tanya has been with us since yesterday, so brand new with the organisation and with the child health work. So welcome, Tanya. I don't know if you want to say hello or...
I'm just here soaking it all up, but I'm glad to be here. It's nice to see you guys join at 8 p.m. as well on a Tuesday evening. But excited to be here and get to know you all. So yeah, thank you.
Brilliant, thank you. And Eva, thank you for reminding us actually about a bit this. Sometimes we look at the sort of staff's job descriptions, they seem a bit long. So it says policy advocacy and parliamentary advocacy, and you've absolutely picked up on why that last word, why we add that in, why that's important. So we're not just about doing research, important though that is the basis of a lot of things that we can then take forward, but we actually do something with it. We try and get it to the decision makers. So thank you for stressing that. It's a really important part of what all of us on this call do. It's the advocacy. So let's get on with the first of our Kickstarter questions, which I think is coming from Stort Valley, if I'm right.
Yep, you're absolutely.
Go ahead, Pete.
Okay. So hi, Eva. Hello, everybody.
Hello.
My first question is, what is the current situation globally with the new outbreaks of polio?
Thank you. So obviously there's been a lot in the news, and Naveed has touched on it earlier. He also did last month, because there was, concerning news coming out of the Middle East on polio. I thought I would just take us one step back to think about the UK situation and how, polio was obviously here. It was a very big problem. The last case of wild polio in the UK was in the 80s. The last outbreak was in the 1970s, and Europe was declared polio free in 2003. I, as a physician, have never seen live sort of a living polio infection in 12 years of practice, and that really tells you something. It's a success story of vaccination. We study polio as an almost history of medicine module. Cases like Paul Alexander, with the man with the iron lungs, who only just died earlier this year, as a sort of a living case of polio. But obviously colleagues around the world still deal with this very, very much. And while sort of type 1 polio is still endemic in Afghanistan and Pakistan, type 2 and type 3 have been eradicated in the past sort of 10 years or so. But we are seeing outbreaks. For example, Africa was declared free of sort of wild polio, but there's been reemergence in places like Malawi. What we're seeing at the moment is, well, not wild polio, but polio outbreaks in, let's say, conflict and fragile situations. So as well as the wild polio that was never eradicated or hasn't been eradicated in certain parts of the world, we also see places that have been polio free, for example, like Gaza, which has been polio free for 25 years because of conflict, because of destruction to health systems and water and sanitation, sewage, lack of immunization programs, because of safety of health workers and lack of provisions, has just meant that this can come back. It's the same story in Sudan, for example, with the war which also broke out last year. And so even outside of conflict, there was, of course, famously a case of a detection of isolates in London a couple of years ago that had people sort of, very concerned. And it's likely that that was more to do with sort of, vaccinations rather than polio becoming widespread. But even then, even though it was one isolate and, you know, in a sort of in the water system in East London, there was still a local vaccination campaign mounted, just because you really can't leave it to chance. And I suppose when you compare the stability and security and you know, effective systems that we have in the UK, where you can still get you know, polio rearing its head, essentially, you know, you can imagine how tricky it can be in places where, you know, the system is on the ground for many, many reasons. I just wanted to say something about polio mechanisms and the work of the GPEI, and that it sort of goes beyond just simple vaccinations. You know, people in places like Pakistan, for example, actually leverage or barter with the polio schemes in order to bring other provisions to their neighborhoods. And, you know, it might seem sort of cynical to not necessarily hold off vaccinating your children in order to barter for more, but, you know, sometimes communities adapt to the rhythm, to the beat in global health, where programs are funded and there's a global action and a commitment to things, that when the vaccination program rolls into town, communities very rightfully say, well, there are other things that we're missing, and we would like those brought in. And so it's sometimes on the back of GPEI's programs, other social good can happen. And I think that is an important piece. The piece I'm writing on Afghanistan, for example, on how women who, since the return of the Taliban, have had to retreat from public life, essentially. You know, the community health workers, the female frontline healthcare workers who are involved in polio vaccination, actually, you know, this have a reason to be out and about, have a reason to be visible, have a reason to be seen in the community and to carry out work, a job. And so that element, that social element, is quite a useful and empowering thing on top of the vaccination story.
Thank you, Eva.
Thank you.
Yeah, so a bit of an overview of the sort of situation with new outbreaks, but really important to remind us that in each place where it does have to be dealt with, there's a specific social context and a medical context as well. So I'm sure that'll come up again later in the conversation. Can we move on to our second question from Cheshire this time, I think?
Yep. Hi, Naveed.
Hi, Sanjay.
Hi, Eva. So the second question, what now needs to happen to make sure we are still focusing on eradicating polio completely?
Thank you, Sanjay. So obviously the GPI is still working. We've discussed that, you know, the latest vaccination campaign in Gaza just at the weekend. And, you know, we are trying to do in a country that's not endemic, that's not having polio outbreaks occurring, is to ensure that the resource mobilization piece is, you know, going on unabated. And so for us, for our part, you know, all of results, staff and grassroots together, the goal is to renew the GPEI's funding from the UK and of course other donors as well. And we do work in international networks where we talk about our resource mobilization efforts. We share intel, we triangulate and try to make the case for country governments to continue to fund the work of the GPEI. One of the concerns in the sector at the moment is what we call donor fatigue. And essentially, you know, it is what it's, you know, sounds like, that donors sort of start to ask, well, you know, you're supposed to have eradicated it by now, what's going on? And actually it's just about following, you know, the epidemiology and following exactly what's happening. There's no magic to it here. Polio is still around, it's still endemic, it's now coming back. And of course, this is something that has been seen in other contexts. And until every last case of polio is gone and we are satisfied that it's been eradicated, and including a monitoring period afterwards, you know, we can't say it's gone away. The other difficulty in terms of focusing on polio eradication and therefore funding the GPEI to work on that is let's say the landscape. You know, Naveed was talking about cuts to overseas development aid. That's not just here, it's also in other countries. We also have multiple replenishments. It's not just the GPI asking for money this year. There are, quite a few big major players, some of whom work with the GPI, that also need funds. And of course, we have that last pledge in 2019 that was, cut really massively, really gutted. And we want to make sure that the UK has the GPI on its radar and that it continues to fund its work until we reach our goal.
Thanks, Eva. And so, yeah, I think you've really touched on a couple of things there. Firstly, the kind of ongoing work in communities, the funding that's needed to make sure that that continues to happen. And also, you kind of touched on this a little bit earlier, the fact that, so for example, for you, this seems to be a matter of kind of historical interest in the UK, but actually, if potential funders have that attitude, they're not going to realise the need around the world. And so we actually got to remind people of the need that is still there and will be there for a while to come, and that is going to be a part of really persuading people on those kind of fundraising efforts. So thank you for touching on all of those things. So I'm going to head over to London if I can for the third starter for 10 question.
Hi, yeah, that's me. So thank you. We've been campaigning on polio back in April of this year with the previous government, and we were just wondering what happened as a result then and what is different now.
Thank you. Thanks, Kush. Yes, it's a very good question. The first thing to say is that back in April, pre-July 4th, shall we say, our influencing both on the staff side and the grassroots campaigning side supported the official UK ask for the GPI of £50 million for 2025 and 2026. And we received a letter from the then International Development Secretary, Minister Andrew Mitchell. It was a very warm letter, it was sort of well received. We hadn't had a commitment at that point, but we knew that, it was on his radar and it was at least noted and being thought about and considered. Now, within weeks, the general election was called. So what's different now is, of course, a new government. And within this new government, that some MPs are known to us. The Foreign Secretary is a known entity. The International Development Minister is sort of newer. That's not somebody who we were working with in the shadow government, for example. There are new MPs, a record number of new MPs who, may have never really got involved in global health. And so there's a lot of what we call sort of mapping the stakeholders, mapping their portfolios. What have they been assigned? What's the brief? But also, what's their interest? What do they want to engage on? And so again, some of that, not just mapping, but triangulation. We speak to each other within our own kind of departments of the policy parliamentary team, but we also speak to others in the sector and civil society. We speak to the Foreign Office, who are dealing with ministers on a daily, weekly basis and getting ideas and intel that way on their interests, and trying to speak to what they will hear in order to make visible, the work that the GPI is doing. So obviously we know that we have an emergency budget coming up, an emergency spending review with a budget at the end of October. Luckily, we have our ask in, so it's a matter of following up. And the reason that that's so key is that with this landscape of cuts in ODA, multiple replenishments, not having to start from scratch in a way is really, really helpful. So all of that work that was done around the ask, the fact it's in, would have, hopefully stood us in good stead. Now, the new government has no obligation to really honor any ask that's been put in. Under a previous administration, we had a musical and strange anecdote from one FCDO official who said that in the last change of government, there were sort of 500 asks and, nearly commitments in, and that actually once the new administration was in, they sort of cut or abolished or ignored all but 100 odd, out of 500. So there's no real telling of what will be sort of seen, answered, committed to, from one parliament to another. And so on the one hand, we have an ask in, it is with the UK government, but at the same time, we're still doing some things to push it, like a novel ask to a new MP, and a department with perhaps new priorities. So in terms of the stance of the new administration, again, some of that intel gathering, we know that Annalise Dodds is an economist by background. And then, some of the information that we glean from the sector is that she responds to numbers. She wants to hear about health from an economic point of view, cost versus benefit, that she's already asking good questions. And we're also learning, about new MPs, for example, Andrew Gwynn, who's been given a brief within the Department of Health, looking at child health and infectious diseases, quite a wide mandate. But, hearing, for example, that he believes in the moral case for health, these pieces of information give us an idea of the person and, who we're trying to understand and write for in order to make a case which, by and large is a moral case, a case for good in vaccinations, but also a case for, security, global health security. And we saw during COVID, for example, how the sort of mantra of, none of us are safe until all of us are safe. And I think that is very much a case with polio. And actually, I do remember Aidan O'Leary using those words or paraphrasing. And it's, people don't think of polio that way. It feels like something relegated to history, but really it's with international travel, the global world, it needs to be thought about and considered. So, the new government, kind of a blank piece of paper. So it's all to play for, but at the same time, lots of work to do. And I guess that's why we're here now. Thank you.
Thanks, Eva. There's a lot to think about there in terms of the work that's already been done, how much of might have stuck with the previous administration and with the civil servants, and how we're going to need to pick that up with the new government. So lots of reasons why some of those moral cases and economic cases for polio eradication still need to be made, or rather made again, because some of us have made those arguments. Obviously, some of you have made those arguments, over and over again over the years. So thank you for tackling those three sort of pre-prepared questions. We're going to open to the floor now. As always, please just either unmute yourself and ask your question or put your question into the Zoom chat box. And if for any reason that doesn't work for you, you can also text me. I've got my phone here, and the number for that is 07906 662 571. That's 07906 662 571, and I'll keep my eye on that as well. So does anyone want to kick off with just a question verbally, or?
I'd like to, yeah.
Please do, Pete.
Okay, so earlier on in the presentation, what was mentioned was type 1 and type 2 and then wild. So these are distinctions that I'm not familiar with. Could somebody clear that up for me?
Sure, Pete. I obviously went back to the drawing board just to brush up on all of these things, because I also hadn't looked at them for a long, long time. As I said, relegated to the realms of history. But essentially, type 1, 2, and 3 are the wild polio virus. Type 2 and 3 are eradicated as of 2015 and 2019, I believe. And wild polio virus type 1 persists in Afghanistan and Pakistan, with some reemergence in other areas, in other countries, like Malawi. The polio virus that we're seeing in some of these conflict situations, like in Sudan and in Gaza, is more to do, sort of more of its genetic profile is slightly different in that it's sort of linked to vaccinations and polio virus that is given within the vaccination, a weakened form that can sort of hang around, and with a long time and with poor sewage and sanitation systems can reactivate and infect people. And so that's why it can become important again.
So are you saying that the type of polio that's been detected in Gaza is in fact iatrogenic, to be fancy, is actually delivered by the vaccine itself?
In the sense, it will be in the sewage system, and it's been linked genetically to samples found in Egypt last year. So in some way, its genetics are iatrogenic, meaning they come from a vaccination somewhere in someone, but how they got into the Gaza system, you know, polio virus is transmitted through both the fecal-oral route as well as sort of cough, you know, droplets of coughs and sneezes and that kind of thing. So given that this is something found in water and sewage systems, it's likely something that came from sort of the enteric system. It's very likely, you know, using words like variant polio virus, I've learned generally means from vaccine sort of DNA, altered DNA, whereas if they use the sort of the terminology wild, that's slightly different.
Thank you.
Thanks, Eva. Richard, you've got a hand up. Do you want to go?
Well, just a question that might be a rather stupid question, but they're vaccinating the children, and what about the adults? Well, adults have already been done, and presumably adults can catch polio as well, can they?
Yes, anybody can catch polio. Children under 5 are most at risk, and depending on your sort of age and vulnerability profile, so brand new children, you know, newborns, children under 2, children who haven't been vaccinated at all, children who haven't received all of their vaccinations, pregnant women, people who are immunocompromised, either because of medication or, you know, in conditions like HIV, you know, they can be the most at risk. But yes, technically anybody can get polio, but some are just that more susceptible to suffering from it. And even its symptoms, not everybody gets symptoms, not everybody you know, develops the kind of paralysis profile that's been so stark in some of the new cases that have emerged in Gaza. But you are right that it could be anybody. The idea is that adults should have received their vaccinations. You know, Gaza's been 25 years without polio, and so really you know, when you're thinking about a 10-month-old, you know, in July being sort of having contracted this and suffering with it, you know, they're born within the scale of the conflict, within the timeline of the conflict. So that's, you know, probably more to do with not having been vaccinated, more likely. But yes, it's a good point to bring up.
Thank you. I note that Jill has a question in the chat. How much of the 2019 pledge to GPI was actually delivered and how much was cut? I don't know if you have any numbers to hand, but I did a quick survey not so long ago. But do you want to kick off? And
I think with Alex being the RMG and having been around in that time span, she might be better to field, and she does have a hand up.
Alex has said you need to check the figures, I think, in the chat, but I did do a little bit of searching. Do you want me to?
Well, I've just had a quick look, and it's in the region of about 90 to 95%.
Oh, okay, that's more than I thought. And the last time I looked, they'd spent at least, I think, 110 million. That was a good few months back now. So.
Well, sorry, in terms of the 2019 ask, once once ODA was cut from 0.7 of gross national income to 0.5, the overall cut for the polio budget specifically was initially 95%. I'm not sure that it actually ended up being exactly that, but I will put the link to the GPI press release in the chat.
Thanks, Alex. It is quite difficult to trace what actually government spending has been over recent years, particularly as over the last several years, they've not been as transparent with spending as they had been previously, and that is getting better. But it has been quite difficult to track some of these things in recent years.
Naveed,
Jill, go ahead.
Alex, you're saying that only 5% was left. 95% was cut. That might be something that we need to mention to the new minister. You know, because she's been tweeting out how good it is that we're supporting GPEI.
So we might need to get some figures back to you for that. So there was a 95% cut, but there have been a number of bits of expenditure since then, but it's very hard to track, as I say.
Okay.
But yes, absolutely. I think it's really important to say, look, on the one hand, we're spending less than we said we would, and on the other hand, there's all of this urgent need. I think that's the main message. And we've got some links, I think, in the action materials where hopefully you'll be able to find some figures. And I'm sorry, we haven't got the usual, exact figures for you. Oh, Kush, go ahead.
Oh no, I was if you're in the middle of something, feel free to finish. I was just going to add a bit more to Eva's answer for Peter's question about the vaccination.
Yeah, go ahead. I think unless anyone's got any other points on the numbers, I didn't have anything to add at this point.
Yeah, no, it's vaccination for polio is very complicated because there's different types of vaccines. There's an injectable vaccine and there's an oral vaccine, and they're both better and worse in different ways to each other. So in countries that don't really have very much polio, we just use the injectable vaccine because that helps protect people from getting polio disease, i.e. like the paralysis, which is sort of a rare complication, or not rare, but not everyone who gets polio gets the paralysis, but a fair proportion, although a minority do. But what it does not do is it does not protect you from getting infected and from transmitting the infection, which is what the oral polio vaccine does do. But the problem with the oral polio vaccine is that it's a live attenuated virus, which means it's a weakened form of the virus, but it is alive and it is able to replicate. So in high burden, well, not high burden, but in areas where it is still circulating, in order to prevent someone from becoming infected with polio, that's why they have to use the oral polio vaccine as well, to provide both types of protection. But the risk is that sometimes some of that virus then does mutate and can go on to cause infection, which is what we're seeing in Gaza. But that's only a risk if the population is unvaccinated. So this sort of vaccine-derived virus can only cause infection in people who are unvaccinated. So actually, the solution is still vaccinating. It's not that it's suddenly mutating into some horrible, deadly virus that is going to take over the world. It's a weakened form of polio virus, and on balance of risks and benefits, continuing to vaccinate is by far and away the best solution to this problem.
Thanks, Kush. Absolutely amazing to have that medical knowledge on hand for this call. Thank you so much. I don't know who was first. Was it Kathy or Sanjay? Oh, Jay, hello.
Hi.
Or Sanjay on screen. Hi.
Yeah, can you please remind me what's the criteria for declaring an area free of polio? I mean, I know we've discussed it before, but what's the criteria for saying, okay, this particular area, we have eradicated polio from this area?
I think from my reading, obviously, our work supporting the GPI is resource mobilization, speaking to the UK government and making the case for the work of the polio of the GPEI, Global Polio Eradication Initiative. In terms of the criteria and the ins and outs, that's really the operations team within the GPI that work on that, the technical teams. From my reading, for example, when the Afro region, Africa was declared polio free, they'd monitored samples for 4 years and then made that declaration. So that's just to give you an idea of a kind of timescale. But it may depend on the context, in the sense that if you monitor London for a certain amount of time, or you monitor Afghanistan for a certain amount, or Gaza, depending on what else is happening in terms of the health system, the sanitation, the general, other things like malnutrition that affect how people respond to vaccines and to ill health. All of those things I think will affect the timeline. That's my sense, that it needs to be somewhat context specific, rather than just a number of weeks or months. But I saw Alex put a hand up. If you have anything else to add, please do.
It was just to say that, as Eva said, you have to, the country or region has to have been free of new cases of polio for a specified period of time, but there's a process that they go through called certification, where there's a formal assessment process. And then also, once you've been certified as being polio free, there is also a monitoring process that goes on after that. So it's not just a kind of, oh, look, we haven't had a polio case for a week, everything's good, we can go home. And you need to continue vaccinating even after you've been certified polio free for a period to make sure that obviously that you remain polio free. So it's getting to certification is a major win, but it's not the complete end of the story.
Thanks, Alex. We're nearly out of time, but I want to make sure we get through to Kathy's question. She's had her hand up for a while.
Well, my question sort of follows on from Kush's in the chat question, which was talking about how in certain areas the teams doing the polio vaccination have been compromised by the CIA doing that. But on the other hand, the thing that you were talking about, which was that the polio vaccination teams being not just about polio, but about whole sort of delivery of a package of health systems or other things, Eva, that you were mentioning. I wonder whether there is the sort of balance that in general, is it welcomed when the polio team come, and has COVID as well had any, with all the anti-vaccination, the anti-vax people on that, had any impact on the sort of general level of take-up of polio? Thank you.
Thanks, Kathy. It's a complex question. I think it goes to the murky history of aid, doesn't it? And the fact that there has been a lot of contention as to how aid has been used in the past. You know, aid trucks full of weapons, you know, all that kind of stuff, you know, crossing borders because, you know, which some side wants to support another side. And the trust being undermined in vaccination programs, even in aid programs in general, is a big problem. And it will be a bigger problem in some regions than others. So the one that, you know, Kush cited in Afghanistan will undoubtedly have problems. And I remember, you know, I joined results in January, and just reading some of the comms that were coming through about immunization, you know, convoys and workers being shot at and coming under fire and things like that. You know, it's still very much a hot topic. It hasn't gone away. And I suppose people in the arena, and, you know, I've got my notes from Aidan's talk, because I remember him talking about how the GPI must operate in a humanitarian space and, you know, show an attachment and a deference to all of those, you know, core humanitarian principles like neutrality and so on and so forth, and to honor those commitments, and to, you know, to listen to local populations and walk the talk and so on. The thing is that each time something happens for political reasons that undermines humanitarian action, it will reset the game. It will set us back a few steps, if not to square one in some respects. So I'm aware we're at time, but it's complicated. I couldn't give you an overall view of the global picture of, you know, are they the good guy? Are they the bad guy? But, you know, there are bad examples. There are bad moments and difficult ones. And some would say that, you know, the mission to find bin Laden had its own good outcomes. Others will say this is all about balancing, you know, good guys versus bad guys, which is also contextual. So it's a difficult one. I haven't come across anti-vax in relation to this. You know, one good news story we had today at the global call for polio was that they were saying that the response has been incredible to this polio vaccination campaign since for the past 2 days, and the queues of parents bringing their children despite the odds, despite fear that actually it might not be a safe thing to do, being out and you know, and queuing up and being concentrated like that. So I thought, you know, that's a belief and maybe a need to believe in something good is yeah, what trumps it all. I don't know if I've answered your question.
Thank you, Eva. It's obviously, you know, very, very complex around the world, and I hope we've done a reasonable job this evening of kind of presenting an overview. There's lots to dive into, and do email us if you have any particular questions. At the end of the day, it is going to be about using these examples, perhaps Gaza, perhaps other places around the world, of examples of how, you know, we really have to carry on doing that job. And it's great to have heard some of the kind of complexities, some of the medical implications this evening. There's obviously a lot more to dive into if you would like to. So I'm going to have to call this call to a close for now. Thank you to all of you for all of your advocacy efforts, as always. And, you know, now we are, you know, the new government's starting to get up to speed. As you can hear, our colleagues in the policy and parliamentary teams are working very hard to influence government policy and engage new MPs in this ongoing topic. And hopefully we can all together help to influence their priorities. So, as I said at the beginning, I know we found that MPs haven't been terribly responsive. But the Minister, Annalise Dodds, is apparently keen to hear from MPs on the issues that they're currently concerned about. So this is why we're asking you to write to the MPs and go via them rather than write directly this time, even though, you know, they haven't yet all been terribly responsive. So please do that. Ask them to write to her. There is a bit of a time limit on this one because we know the spending review is at the beginning of October. So that does mean that they need to have time to write to the minister. So really, the sooner you can do your letter to your MP and tell them about the urgency of it, the better. As I said, you may wish to use the situation on the ground in Gaza as an example of why it matters now. Jill, thank you for sharing in the chat one of Annalise Dodd's comments about how important it is for that money to get there and that vaccination campaign to be happening. But obviously that can only happen if GPI has the money, if the WHO has that money. So that's, you know, an example coming out of her own mouth as why we need her to provide the checkbook to do this. So I've also put a link in the chat from the GPI itself, their website, which has got a whole lot of stories from around the world on why polio eradication matters. So do have a look at that if you are looking for examples that you feel you want to use. As always, you know, we come to the very end. We need to finish. I want to respect your time. So been great seeing you. Thank you so much. The next grassroots call, as always, the first Tuesday of October. That's Tuesday the 1st at the usual time, at 8 p.m. And now, if those of you if some of you would like to stay after the formal ending of the meeting for an extra half an hour or so, we are very, very happy to keep the lines open to have a chat for a bit. But if you're not staying for that, thank you for being with us and enjoy the rest of your evenings.